Hey everyone, I wanted to do this video in combination with a video I did on TikTok, briefly summarizing this. I came across a TikTok last night, which was an autism parent praising the passing of the Autism Cares Act of 2024. I had never heard of this act before, so I had to do a little bit of research. On congress.gov, in fact, if you Google search Autism Cares Act, one of the top links is for Congress's website, where you can actually view the act in its entirety, the bill, everything. But it comes from it originated with the Combating Autism Act of 2006, which was signed into law by George W. Bush. And the wording of that act is very eugenic based, similarly with the Autism Cares Act of 2024. Very eugenics based, very preventative. In fact, in the 2024 act, which is just a rewording of the Autism Cares Act of 2019, two words stood out to me when I was reading that, and it's in section 2, right at the beginning of the act. It talks about the prevention and treatment of autism. In fact, let me go ahead and bring this up real quick. In section 2 of this act, it says that section is for research. In the edited version that has been going through Congress, it just rewords things. Section 2, National Institutes of Health Activities. In the original document, it says each center under paragraph 1 shall conduct basic and clinical research into autism spectrum disorder. Such research should include investigations into the causes, diagnosis, early and ongoing detection, prevention, and treatment of autism spectrum disorder across the lifespan. The centers, as a group, shall conduct research including the fields of developmental neurobiology, genetics, genomics, psychopharmacology, developmental psychology, behavioral psychology, and clinical psychology. This was reworded in H.R. 7213, says, by striking shall subject to the availability and inserting the following: in consultation with relevant federal departments and agencies as appropriate, shall, subject to the availability, by striking basic and clinical research in fields including pathology, and inserting the following: basic and clinical research in fields such as pathology. So it's just the Autism Cares Act 2024 is just rewording the Act of 2019, which in turn reworded the Act of 2006. 2006. I did a little bit of research on the Combating Autism Act of 2006 because it is now retroactively, by different agencies and nonprofits, being called the Autism Cares Act of 2006. However, that's not what it was. It was the Combating Autism Act of 2006, which on Wikipedia it says is an act of Congress, public law that was passed by the 109th United States Congress, Senate Bill 843, and was signed into law by President of the United States George W. Bush on December 19, 2006. It authorized nearly $1 billion in expenditures over 5 years, starting in 2007, for screening, education, early intervention, prompt referrals for treatment and services, and research of the autism spectrum disorder of autism, Asperger's syndrome, Rett syndrome, childhood disintegrative disorder, and pervasive developmental disorder not otherwise specified. The bill was introduced in the Senate by Senators Rick Santorum and Christopher Dodd, and passed the upper chamber unanimously in August 2006. The House version was introduced by Congresswoman Mary Bono and Diana DeGette, and was passed by the lower chamber on December 6, 2006. The House version differed slightly from the Senate version, directing funds for research to the Secretary of Health and Human Services rather than directly to the National Institutes of Health. By passing this landmark single disease legislation, The House has recognized the daily plight of the thousands of families struggling every day with autism, and has once and for all acknowledged autism as a national health crisis, said Bob Wright, co-founder of Autism Speaks and chairman and CEO of NBC Universal. The House passed a version that would grant more authority to scientists to determine research priorities, whereas the Senate's original measure would have included funds for expansion of research into the causes of autism. The revised bill ultimately approved by the Senate did not include the provisions that would have specified funding for investigating possible environmental causes. This bill is a federal declaration of war on the epidemic of autism, said John Shestak, co-founder of Cure Autism Now. It creates a congressionally mandated roadmap for a federal assault on autism, including requirements for strategic planning, budget transparency, congressional oversight, and a substantial role for parents of children with autism in the federal decision-making process. The act authorizes the director of the NIH to create an autism czar who would coordinate NIH-based research and oversee development and budgeting of autism research, and would increase the number of centers of excellence on autism from 8 to 10. An information and education program and its risk factors to be provided to the Department of Health and Human Services to health professionals and general public. Commitment of $75 million a year by the Health Resources and Services Administration for each of the next 5 years for grants for states to develop autism screening, diagnosis, and intervention programs, and to create statewide screening systems to ensure all children are screened for autism by the age of 2. $25 million a year for 5 years for technical assistance and data management to states for autism screening, diagnosis, and intervention programs. Now, if you're thinking, well, that was back in 2006. Things have changed since then. The act is still the same. They've just reworded a few things. And even on Autism Speaks website, they still promote it. It's still, even though Autism Speaks has gone through this rebranding, saying we've changed and all this, they're still promoting the Combating Autism Act of 2006. However, they've changed the name of it. That's all they did, was change the name to the Autism Cares Act. And on their website, the Autism Collaboration, Accountability, Research, Education, and Support Act, Autism Cares Act, is primary source of federal funding for autism research, services, training, and monitoring. Over the past 2 decades, over $5.2 billion has been dedicated for autism at the National Institutes of Health, the Centers for Disease Control and Prevention, and the Health Resources and Services Administration because of the Autism Cares Act. They are directly referring to the Combating Autism Act of 2006. It didn't become the Autism Cares Act until 2019. But by saying that over the past 2 decades, it's now 2024. 20 years ago, I guess it would be 18 years ago, but regardless, it's close enough. Originally passed in 2006, the Autism Cares Act has been the primary driver of progress in our understanding of autism, as well as the development and dissemination of support for autistic people across the spectrum and lifespan. The current version of the law, the Autism Cares Act of 2019, expires on September 30th, 2024. Autism Speaks is working tirelessly with Congress to renew and expand this legislation's transformative work. Because of Autism Cares, scientific developments have set a reliable diagnosis age of 18 to 24 months, established that timely interventions make a lifetime of difference, identified comorbidities, increased understanding of biological causes of autism, identified genes and possible medication targets, developed early career autism research. Autism Cares requires and supports autism prevalence monitoring, training of medical professionals to detect and diagnose autism, development of treatments for medical conditions associated with autism, the Interagency Autism Coordinating Committee and its annual strategic plan, Centers of Excellence in Autism Surveillance and Epidemiology, countless programs and research grants to benefit individuals with autism. The Autism Cares Act of 2014 also required a report to Congress on the current state of adult services. The 2017 report to Congress, Young Adults and Transitioning Youth with Autism Spectrum Disorder, it's linked on the website, addressed where gaps exist and how to address those needs. Now, like I said, there are a lot of things in these acts that I can get behind. But the fact that it was originally named the Combating Autism Act of 2006, and that it was supported by Bob Wright of Autism Speaks and John Shystak of Cure Autism Now, who call it an epidemic and a national health crisis, just can't be ignored. The fact that in Section 2 alone, it talks about the prevention and treatment of autism. I can't wrap my head around this. Why anyone would support that? I myself am autistic. My son is autistic. There may or may not be other autistic individuals in my family. None diagnosed anyway. But autism is very important to me. Advocating for autistics is very important to me. And it's clear in the wording of these acts that Congress, our government, is using eugenics to wipe us out. When they say the prevention of autism, what they mean is abortion, because that is the only way to prevent autism, is through abortion. Because it's genetic, it's neurobiological, that is the only way to prevent autism. And for those of you who don't know what eugenics is, it's essentially what the Nazis did. Our country also did eugenics in the early 20th century. For the longest time, actually. Such as making it so that African Americans couldn't procreate. Doing experiments on different ethnicities, different people with different psychological needs. It was a horrible time in our history. Eugenics, the clearest form of eugenics, was the blonde-haired, blue-eyed Germans. That was Hitler's superior human race, blonde-haired, blue-eyed Germans. The fact that we're still using eugenics today, or even talking about eugenics today in order to get rid of autism, is despicable. Everyone associated with these acts should be ashamed of themselves. Autism is not something to prevent. It's not something that needs treated. It's who we are as people. It's what gives us our personality. For many, autism isn't the entirety of their personality, but it is what gives us our personality. Without autism, we would be completely different people. By completely deleting our autism, you are effectively changing who we are on a very primal level. And that could be good, it could be bad. But it is not up to anyone else to search for a cure for us. I'm often, in situations like this, I'm often reminded of X-Men comics. The cure for mutants. That's what we are to the general public, to our government, to autism parents, to Autism Speaks and Cure Autism Now. We are mutants. We are something that needs to be wiped out. And that's not right. So do your research, look into it. It all started with the Combating Autism Act of 2006. You had the Autism Cares Act of 2014. I didn't look too much into that one. I'm sure that's when the name was changed to Autism Cares. You had the Autism Cares Act of 2019, and now the Autism Cares Act of 2024. So do your research, Google it. Just those two words in the act itself, in the latest version of the act itself, make me detest the idea of this act. Prevention and treatment of autism.